In the real world, a healthcare provider's boundaries. You can only provide the support you have been trained to give. You can only provide support that is part of your role within your job description, within safe working boundaries. Working within the limits of your role means that you support a person in the way that's outlined in your job description and the person's support plan. It also means following organisation policies, procedures, and taking direction from your manager. Sometimes a person might ask you to do something that is outside your role, the task, or the boundaries of your job. It isn't always easy to say no to a person or family you are supporting. If you're ever unsure about what you can or can't do, speak to your manager.
Student answer question introduction. This learning guide is about the aging process and how aging affects people's health and well-being. How to use your learning guide. This guide supports your learning and prepares you for the unit standard assessment. The activities and scenarios should be used as a general guide for learning. This guide relates to the following unit standard. 23387. Demonstrate knowledge of the aging process and its effects on a person's lifestyle and well-being. Level 3, Version 3. This guide is yours to keep. Make it your own by writing notes that help you remember things or where you need to find more information. Follow the tips in the notes column. You may use highlight pens to show important information and ideas and think about how this information applies to your work. You might find it helpful to talk to your colleagues or your supervisor. Finish this learning guide before you start on the assessment. What you will learn. This topic will help you to understand the physical impact that aging has on a person, how a person's needs change as they age.
Page 2. The aging process. The aging process is individual and can vary significantly from person to person. Aging occurs at different rates in different people. How a person ages depends on the effect of factors such as health factors, such as our bodies and our systems, lifestyle factors such as diet and exercise, heredity factors such as family history of health, cultural factors such as ethnicity or practices, environmental factors such as housing or social support. A healthy lifestyle is an especially important factor in healthy aging. We all change physically as we grow older. Some systems slow down, while others just lose their fine-tuning. Aging causes changes in cells. The rate at which cells multiply tend to slow down as we age, meaning injuries and cuts take longer to heal. Certain cells that are important for our immune system to work properly also change with age. Age also causes changes in our responses to environmental stresses or exposures, such as ultraviolet light, heat, poor nutrition, and toxins, poisons. Lifelong influences, such as illnesses, also affect how a person ages.
The physical impact of aging. Changes due to aging. Throughout life, our body goes through physical changes to body tissues and organs. These changes are not due to disease, but are part of the normal aging process. Aging changes occur in bones and joints, and may result in thinning of the bones and osteoarthritis. Muscle structure and strength are also generally reduced and pains are common. Elderly people have poorer balance and tend to walk with short, shuffling steps, and there is less of a tendency to swing their arms. Changes in the structure of connective tissue can result in stiff joints or muscles and body aches. the aging process can have a significant impact on the person's physical well-being and lifestyle. The changes generally occur gradually, allowing people to adapt to the changes and to be able to continue their normal functioning. The impact of these aging changes is more apparent when an older person is in an unfamiliar environment or experiencing physical or psychological stress. The effects of aging on a person who has an existing disability can be greater than for other people. Exercise and diet can make a difference to the rate of changes and can slow down the processes. In spite of the normal, age-related changes, many people can function well for many years by making minor adaptations in the way they do activities of daily living. By understanding how the body functions, we are able to appreciate the changes that occur as we age. The human body is made up of a number of complex systems: musculoskeletal, reproductive, digestive, endocrine, urinary and excretory, respiratory, cardiovascular, skin, nervous, immune, sensory. Next, we will take a look at some of these complex body systems and how aging affects them.
Page 4. The musculoskeletal system. Two of the most obvious changes due to aging are sight and hearing. Many people need reading glasses in midlife due to changes which may occur within the lens of the eye. A person may have difficulty hearing in a crowded room due to changes in the range of sound their ears detect. The musculoskeletal system. The musculoskeletal system is a framework of muscles, tendons, and ligaments which work together with the bones and joints to help the body move and maintain its form. Bones are made up of living cells which constantly grow and reshape themselves throughout our life. As we age, this process slows down. Calcium helps make bones strong, which allows them to support our weight. They also store calcium and release some into the bloodstream when it's needed by other parts of the body. Bones are attached to other bones by long fibrous straps called ligaments. Joints are where two bones meet together, usually at a socket. Joints help make our skeleton flexible so that we can move easily and in many different ways. Muscles. Pectoralis, biceps, rectus abdominis, quadriceps, fore muscles, tibialis, bones, mandible, clavicle, humerus, ribs, sternum, ulna, radius, pelvis, femur, patella, tibia, fibula.
Page 5. How aging affects the musculoskeletal system. Cartilage is a flexible, rubbery substance on the face of the joints, which helps to support bones. Cartilage acts like a shock absorber, protecting bones from rubbing against each other. Muscles are made of tough, elastic tissues that pull our bones by contracting, tightening, and relaxing as we move. Muscles tend to work in pairs, with one contracting and the opposite muscle relaxing. Muscles are connected to our bones by tough cord-like tissues called tendons, which allow the muscles to pull on bones and control movement. When you wiggle your fingers, you can see the tendons on the back of your hand move as they do their work. Tendons, ligaments, and cartilage work together to help the body move and maintain its form. There are more than 650 muscles in the body. They not only help with movement, but also assist the body perform other functions such as chewing food and moving it through the digestive system. Other kinds of muscles keep the heart working efficiently and help the blood to circulate. Some muscles can be controlled by our conscious thought, while others are controlled automatically without us thinking about it. How aging affects the musculoskeletal system. Aging affects all bones, muscles, and joints. Bones lose density and become more brittle. They are more likely to break, fracture, as they weaken. Muscles also lose strength, and joints, as well as tendons, ligaments, and cartilage, can be damaged by injury or disease. Bone tissue also becomes brittle and spongy as we age. These connective tissues lose water and start to dry up, causing the tissue to become less stretchy. This increases the likelihood of injuries occurring as flexibility is reduced. This can result in less movement, and walking and bending may be difficult or even painful. Inactivity or lack of exercise affects our musculoskeletal system and can speed up the aging process. It is important to keep the body moving so that a normal range of movement is maintained for as long as possible. Exercises are one of the best ways to slow or prevent problems with the muscles, joints, and bones, as this helps maintain strength and flexibility and keeps the bones strong. Health problems associated with the musculoskeletal system include arthritis, rheumatoid arthritis, osteoarthritis, and osteoporosis.
Page 6. Arthritis and rheumatoid arthritis. Arthritis. Arthritis literally means inflammation of the joint. Joints become inflamed, causing swelling, stiffness, pain, and difficulty in movement. The two most common of these diseases in older people are rheumatoid arthritis and osteoarthritis. Severe arthritis can limit the ability to walk, dress, or bathe easily. There are a number of devices available to help people with arthritis have an easier time with simple tasks. Examples include easy-to-open bottles, handles on poles to reach high objects, and electric scooters that can help people with severe arthritis to live independently. Rheumatoid arthritis. Rheumatoid arthritis is a condition thought to occur when the immune system attacks the body's joints. There is inflammation and finally long-term damage to the joint lining, resulting in pain, loss of movement, and disability. Soft lumps called rheumatoid nodules, from the size of a pea to a walnut, also occur in about a quarter of people with the condition. Rheumatoid arthritis is a chronic disease that flares up and goes into remission over time. It is mostly a condition that occurs in older adults, but it can also occur in young people in a severe form. Rheumatoid arthritis can start in any joint, but most commonly in the smaller joints of the fingers, hands, and wrists. Joint involvement is usually symmetrical, meaning that if a joint hurts on the left hand, the same joint will hurt on the right hand. Symptoms of rheumatoid arthritis include fatigue, stiffness, weakness and swelling, flu-like symptoms, pain, loss of appetite, and sometimes depression and weight loss. The condition affects almost twice as many women as men. Rheumatoid arthritis is often worse first thing in the morning, but improves as the day goes on and the joints are used. Treatment aims are to relieve pain and inflammation with medication, improve mobility, and limit the damage to the joints. Lifestyle changes such as exercise, stress reduction, healthy eating, and a balance between rest and exercise to boost muscle strength will improve overall health and reduce the pressure on joints. Page 7 and 8. Osteoarthritis. Osteoarthritis is the most common form of arthritis. There is wear and tear in the joints, which causes pain,
swelling, and a reduced range of movements. The condition can occur in any joint, but usually affects the hands and weight-bearing joints such as the knees, hips, or ankle. Osteoarthritis gets worse as the day goes on. Osteoarthritis occurs when the cartilage breaks down in the joints. As cartilage is lost, the bones rub together, and, over time, this rubbing can permanently damage the joint. The rubbing causes pain, swelling, and loss of motion, and over time, the joint may lose its normal shape. Also, bone spurs may grow on the edges of the joint. Pieces of bone or cartilage can break off and float inside the joint space, which causes more pain and damage. Useful ways to manage osteoarthritis pain and improve function are regular exercise, control weight, rest, and pain relief when it is needed. Sometimes surgery is helpful to replace a severely damaged joint. Osteoarthritis occurs most often in older people, although it can occur much earlier for people who have had an injury to the joint. Before age 45, osteoarthritis occurs more frequently in males, but after age 55, it occurs more commonly in females. Osteoporosis. The word osteoporosis means porous bones. Bone cells are constantly being produced and destroyed. After middle age, bone loss takes place faster, and bones become smaller and weaker. Osteoporosis occurs when bones begin to lose some of their essential calcium, losing their strength and becoming fragile, and thus becoming more likely to break. The most common places for a break are the hip, spine, and wrist. Hip and spine injuries are the most serious and require hospitalization and usually major surgery. Women are 5 times more likely to develop the condition than men. They have smaller, weaker bones to begin with, so the effect of bone loss is greater for women. Menopause also has an effect, as estrogen levels fall after menopause. This leads to greater bone cell loss and a higher risk of developing osteoporosis. Treatment is aimed at retaining bone density by slowing the loss of bone cells or increasing the rate of replacement of bone cells. Bones need protein and calcium through a balanced diet to remain healthy. Foods rich in calcium include milk, cheese, yogurt, and other dairy products, green leafy vegetables, Brazil nuts and almonds, tofu, shellfish, and sardines. Vitamin D helps the body absorb calcium obtained through exposure to the sun. Alcohol consumption and tobacco use are thought to increase risk for osteoporosis. Lack of exercise may have the same effect. Regular exercise builds strong bones. The forms of exercise likely to be most effective include aerobics, dancing, jogging, stair climbing, tennis, weighting lifts.
Page 9. Digestive system. The gastrointestinal, digestive system, changes food into fuel ready for the body to use. The nutrients in food give the body cells the energy and the other chemicals they need to function. Before food can do any of these things, it has to be digested, ready for the body to absorb and use. The alimentary canal, or digestive tract, is a long tube which connects the esophagus, stomach, and the small and large intestine. It runs from the mouth to the anus. In an adult, the digestive tract is about 9 meters long. The smooth muscle in the walls of the digestive tract helps move the food through the system in a wave-like action called peristalsis. The gastrointestinal system includes associated organs which help digestion. These include the salivary glands, which produce saliva to help moisten food and start the digestive process. The digestive system has many parts: liver, gallbladder, pancreas, stomach, large intestine, small intestine, sigmoid colon, rectum, anus. The liver produces bile to help digest fats properly, and the pancreas produces chemicals which help digest proteins, fats, and carbohydrates. The liver also plays a major part in processing nutrients which are carried to the liver from the small intestine in the bloodstream. During the process of absorption, nutrients that come from the food, including carbohydrates, proteins, fats, vitamins, and minerals, pass through channels in the intestinal wall and into the bloodstream, which carries the nutrients to the rest of the body. The waste parts of food that the body cannot use are passed out of the body as feces.
Level 3, page 10. How aging affects the digestive system. With age, the intestinal tract becomes stiffer and contractions along its length decrease. Other diseases, such as hardening of the arteries and diabetes, and many medications commonly used by older adults, also have an effect on the gastrointestinal tract. The kinds and amounts of food a person eats and how the digestive system processes this food is vital for maintaining good health. Eating a healthy diet is the best way to prevent common digestive problems. The chance of developing a digestive disorder does increase with age. Nearly 40% of all older adults have one or more digestive symptoms, often related to changes that occur in their digestive tract. Digestive disorders. The mouth and esophagus. Swallowing can become difficult as a result of dry mouth or tooth decay. A stroke, dementia, or conditions such as Parkinson's disease can lead to swallowing difficulties. The strength of the muscle movements in the esophagus reduces with age, making heartburn and indigestion more common. The stomach. With age, the stomach takes longer to empty into the small intestine, making older adults more vulnerable to ulcers and bleeding from medications such as aspirin and some anti-inflammatory drugs. The longer these medications are in the stomach, the more likely they are to cause these problems. The stomach also becomes less elastic and holds less food, meaning that older adults feel full more quickly. The small intestine. The small intestine becomes less able to absorb certain vitamins and minerals, such as vitamin D, vitamin B12, and calcium. Bacterial activity changes can lead to bloating and flatulence, diarrhea, and sometimes weight loss in older adults. The large intestine. A loss of muscle strength can lead to diverticulosis, small pouches that bulge outward through weak points in the intestinal wall. Food also takes longer to move through the large intestine, resulting in constipation. Polyps, small stalk-shaped growths, and colon cancer are more common in older adults, although doctors are unsure what effect age has on the development of these growths. Other digestive changes. The liver becomes less able to break down medications, so it is more likely to be damaged. The gallbladder produces less bile, which may lead to gallstones. The pancreas, however, does not seem to change much with age. Level 3, page 11. Fecal incontinence. Fecal incontinence is the inability to control bowel movements so that feces leak from the rectum. Fecal incontinence can range from an occasional leakage when passing wind to a complete loss of bowel control. The digestive tract processes food as it passes through the body, sending nutrients into the bloodstream and collecting waste that the body cannot digest in the intestine. As food waste passes through the upper portion of large intestine, colon, the body absorbs nearly all of the water from the waste. The remaining residue, called feces, is usually soft but formed. It consists of undigested foods such as fiber, unabsorbed water, bacteria, mucus, and dead cells. Waste collects in a short canal called the rectum. above the outlet from the body at the anus. This is controlled by a sphincter muscle, which acts rather like a valve. As the rectum walls stretch, it signals the need to have a bowel movement. When this happens, the sphincter muscles relax and the rectal walls contract to increase pressure. Abdominal muscles may also be used to help increase downward pressure so that feces are passed out through the anus. The person must have the physical and mental capabilities to recognize and respond to the urge to go to the toilet. Being physically disabled in some way can make it more difficult to reach a toilet in time. Fecal incontinence is more common among older people who sometimes have to cope with the lack of bladder control, urinary incontinence, as well. The condition is more common in women than in men because it can be a complication of childbirth. A person with fecal incontinence may try to hide the problem or avoid social settings. The loss of dignity associated with losing control over bodily functions can lead to frustration, anger, and depression. Fecal incontinence can also irritate the skin because the skin around the anus is delicate and sensitive. The constant exposure to feces can lead to pain, itching, and sometimes skin breakdown or ulceration. Treatment for fecal incontinence tries to restore bowel control or at least reduce the severity of the condition. Depending on the cause of the incontinence, treatment may include dietary changes. Spicy foods, fatty foods, dairy products, caffeine, and some food additives can cause problems. The diet should include fiber from cereals, grains, fruits, and vegetables.
Level 3, page 37 through 38, 9. Integumentary system. Skin. How aging affects the integumentary system. Skin changes are among the most visible signs of aging. These changes are related to environmental factors, genetic makeup, nutrition, and other factors. The greatest single factor, though, is exposure to the sun. Effects of aging of the skin include wrinkles and sagging skin which develop as skin loses strength and elasticity. Blue-eyed, fair-skinned people show more skin changes as they age. Whitening or graying of the hair is an obvious sign of aging. Gradual thinning, although the skin still has the same 3 layers, appears paler and becomes more sensitive to sun damage. Large pigmented spots called age spots, liver spots, or lentigos may appear in sun-exposed areas. The blood vessels of the dermis become more fragile, which can lead to bruising and bleeding under the skin. Rubbing or pulling on the skin can cause skin breakages, called skin tears. Bruises, flat collections of blood, called purpura, and raised collections of blood, called hematomas, may form after even a minor injury. Sebaceous oil glands produce less oil. For women, this becomes more noticeable after menopause. This results in dryness and itchiness. The subcutaneous fat layer thins, meaning the body is less able to maintain body temperature. With less natural insulation, older people often feel the cold. The sweat glands produce less sweat, making it harder to keep cool in hot weather. Growths such as skin tags, warts, and blemishes become more common. A reduction in the ability to sense touch, pressure, vibration, heat, and cold. Skin changes and loss of subcutaneous fat, combined with a tendency to be less active as well as some nutritional deficiencies and other illnesses, contribute to pressure ulcers. Slower healing of aging skin. Wound healing may be up to 4 times slower, leading to pressure ulcers and infections. Conditions such as diabetes, blood vessel changes, and lowered immunity also affect healing. More than 90% of all older people have some type of skin condition. Because most skin changes are related to sun exposure, prevention is a lifelong process. Excessive exposure to strong sunlight has also been directly linked to a variety of skin cancers. Other skin problems can be associated with diabetes, liver conditions, heart disease, and arteriosclerosis. Stress, reactions to medications, obesity, and nutritional deficiencies can be other causes. Chemicals, indoor heating, clothing, allergies to plants and other allergies, and many other common exposures can also cause skin changes. Prevent skin problems by maintaining good nutrition and drinking adequate fluids. Keeping skin moist with lotions. Avoid using soaps that are heavily perfumed. Moist skin is more comfortable and may heal better. Preventing sunburn by using sunscreen and covering up in the sun. Wear a hat, sunglasses, and sunscreen when outdoors in the sun, even on cloudy days.
Level 3, page 12. Fecal incontinence and constipation. If chronic constipation is a cause of fecal incontinence, it may be recommended to drink plenty of fluids and eat fiber-rich foods that aren't constipating. If diarrhea is contributing to the problem, increasing intake of high-fiber foods to add bulk will make feces less watery. Other treatments include bowel training aimed at restoring muscle strength, practicing tightening the anal sphincter and setting regular toileting times, treatment for feces buildup, impaction, which breaks up the bowel motion into small pieces which are then easier to pass, surgery for underlying damage to the sphincter. Tips for managing bowel incontinence include eat smaller meals, drink plenty of fluids, use the toilet before going out, wear a pad, carry wipes and a change of clothing, know where toilets are before you need them so that you can get to them quickly. Constipation. Constipation means that a person has 3 or fewer bowel movements in a week. The feces can be hard and dry, and sometimes painful to pass. Almost everyone gets constipated at some point in their life. While it is not important to have a bowel movement every day, it is important to discuss any bowel changes with the doctor. As food passes through the gastrointestinal tract, the body takes nutrients and water from the food. Wastes are produced and form feces which move through the intestines with muscle contractions, squeezing motions. The feces remain in the rectum until they can be passed out of the body. There are many things that can cause the feces to move more slowly through the intestines, leading to constipation. This can be avoided by eating plenty of fruits, vegetables, and grains high in fiber, drinking plenty of water and other liquids, getting enough exercise, taking time to have a bowel movement when you need to, avoiding laxatives and medications which cause constipation. Level 3, page 13. Cause and effect. Constipation. Feces become dry and hard, making it difficult and painful to pass. Rectal muscles stretch and eventually weaken, and nerves are less responsive to the full rectum message. Watery feces from further up the intestine may leak out around the hard mass. Diarrhea. Solid feces are easier to retain in the rectum than are watery motions, so the loose motions of diarrhea can cause or worsen fecal incontinence. Muscle damage. Injury to the anal sphincter means that the muscles are not strong enough to hold stool back properly, and some may leak out. This kind of damage can occur during complicated childbirth. Damage may not be apparent for many years. Nerve damage.
The nerves that control the anal sphincter or those that sense stool in the rectum are damaged. Can be caused by childbirth, constantly straining when having a bowel movement, spinal cord injury, and stroke. Other diseases can also affect these nerves, for example, diabetes, multiple sclerosis. Loss of storage capacity. The rectum is scarred or the rectal walls have stiffened from surgery, radiation treatment, or inflammatory bowel disease, such as Crohn's disease or ulcerative colitis. Because the rectum can't stretch as much as it needs to, the feces leak out. Rectal cancer surgery and radiotherapy. Cancers of the anus and rectum can lead to fecal incontinence if the cancer invades the muscle walls or affects the nerve impulses needed for defecation. Loss of muscle strength. Over time, muscles and ligaments that support the pelvis, as well as anal sphincter muscles, can weaken, leading to incontinence. This is the most common reason for fecal incontinence in older people. Overuse of laxatives. Relying on laxatives can lead to incontinence. It masks constipation, changes the messages for the urge to pass feces, and may lead to extra straining to pass a motion. Surgery. Some surgery, for example, to treat hemorrhoids, enlarged veins in the rectum or anus, can cause damage to the anus, leading to fecal incontinence.
Level 3, page 14. Urinary system. The urinary system and the digestive system are closely interconnected. They each play a major part in disposing of body wastes. Kidney, ureter, bladder, urethra. The urinary system extracts nutrients from the liquids we drink and liquids that are separated by the digestive system. It is made up of 2 kidneys and the bladder, which are connected by 2 hollow tubes called ureters. Another tube called the urethra drains the bladder to the outside. The kidneys are located just under the rib cage at the back, one on each side, surrounded by a layer of fat to cushion and hold them in place. The kidneys have a variety of functions, including filtering the blood and removing water, salts, and wastes, regulating the blood volume, blood pressure, and composition, producing essential hormones, renin. Urine, which is produced by the kidneys, contains these wastes, salts, toxins, and water. The kidneys also help maintain the fluid balance of the body. Every day, about 1,600 liters of blood pass through the kidneys. About a quarter of our blood is in the kidneys at any one time. The kidneys cleanse all of the blood in the body about every 50 minutes, as well as regulate blood pressure and the level of salts in the blood. Urine is the concentrated solution of waste material that is produced by the kidneys and stored in the bladder. The bladder is a muscular sac which expands as it fills with urine. Adults produce about 6 cups of urine per day. Producing too much or too little urine may be a sign of illness. When the bladder is full, nerve endings in its walls send a message to the brain. When a person is ready to urinate, the bladder walls contract and the ring-like muscle, called a sphincter, at the exit from the bladder relaxes to release the urine through the urethra. The male urethra ends at the tip of the penis. The female urethra ends just above the vaginal opening. Incontinence of urine is more common in people with a dementing illness and cerebrovascular disease, as this causes interference with the brain control of urinary function. The reasons for incontinence of urine are many, but the result can be embarrassing and worrying and can limit the ability to take an active part in life. The doctor will decide if treatment with antibiotics is required based on laboratory tests or symptoms. However, when an infection is suspected, drinking plenty of fluid is helpful to dilute the urine and reduce the chance of complications.
Level 3, page 15. How aging affects the urinary system. Many elderly people have problems with disturbances of urinary function. They have to empty their bladders more frequently and wake up in the night more often to pass urine, particularly men with enlargement of the prostate gland. In addition, they may suddenly feel the desire to pass urine but may not be able to get to the toilet in time, partly because their feelings occur so suddenly and also due to their slower mobility and possibly weakness of bladder muscles. From about age 40 onwards, kidney function slowly declines. By age 70, it may be only reaching 65% of previous capacity. This causes a reduced ability to concentrate urine, meaning that more water is needed to excrete the same amount of waste from the body. This can cause dehydration, drugs to be excreted more slowly, less water and sodium to be reabsorbed, and more potassium to be lost in the urine. Bladder and sphincter muscles lose their tone, stretchiness, which can lead to leakage of urine from the bladder, or there is a need to empty the bladder more frequently, often at night. Because the bladder does not empty as well, the incidence of bladder infection increases, especially for women. In addition, the ability to control urination can be lost after a stroke, Alzheimer's disease, or some diseases of the nervous system. Men can develop urinary retention due to an enlarged prostate gland. Pressure from this swelling on the urethra can restrict or prevent the flow of urine. An enlarged prostate also increases the urgency for urination. Level 3, page 16. Urinary tract infection. Urine in the healthy bladder is normally free of bacteria. However, bacteria from the rectal area can enter the urinary tract through the urethra and travel the short distance to the bladder, where they can multiply rapidly and cause a urinary tract infection, UTI. Up to 90% of UTIs are caused by intestinal bacteria, such as E. coli, that are normally found in feces. These bacteria can multiply rapidly, causing infections anywhere in the urinary tract, including the kidneys. However, most UTIs occur in the lower urinary tract, especially in the bladder and urethra. The risk for UTIs is highest in women after menopause. Up to 25% of women over 65 years old will get a UTI, due in part to reduction in the hormone estrogen and its effects on the walls of the urinary tract, which become thinner and weaker. This makes it less able to resist bacteria and at greater risk of recurring infections. Urinary tract infections, UTIs, can lead to acute illness in the elderly. The condition usually affects more women than men, and it is common for reinfections to occur. Factors that can lead to urinary tract infections in older people include recent use of a catheter, diuretic use. Some diuretic, fluid medications can cause a person's urine to be very concentrated, requiring as many as 10 glasses of water per day to compensate. Prostate enlargement. Certain types of incontinence, which prevent a full bladder emptying properly. People not drinking enough fluid, especially water, increases the risk of UTIs. Diabetes that is not well controlled. A person with an infection of the urinary tract commonly experiences frequent and urgent need to urinate, painful urination, cloudy urine, lower back or abdominal pain, blood in the urine. There can also be fever, chills, nausea, and vomiting. However, many older people may have few symptoms, up to 50% in women, so it can be hard to know whether there is an infection present. UTIs are the most frequent infection in residential care settings. Level 3, page 17. Urinary incontinence. At least 1 in 10 people aged 65 or older suffer from some loss of urine. There may be only a slight or occasional loss of urine or ongoing and severe wetting. Many people with incontinence problems withdraw and become socially isolated or try to hide the problem. In most cases, incontinence can be treated and controlled. It can result from changes in the body tissues or from the effect of some medications that can lead to incontinence. It may also be brought on by any illness, hospital admission, or difficulty getting to the toilet on time. It can also be the only symptom of a developing urinary tract infection. People who have problems controlling urination should see their doctor. Treatment of urinary incontinence depends on the cause. It can include exercises to strengthen bladder muscles or medication or surgery to treat an enlarged prostate. Management of the condition is generally very effective, including using special underwear or continence products, regular toileting, or improving access to the toilet if poor mobility is a factor. Catheterization or an external collection system for men is sometimes used, but can lead to problems with infection. There are several common forms of incontinence. Stress incontinence, the leakage of urine during exercise, coughing, sneezing, laughing, lifting heavy objects, or other activity that puts pressure on the bladder. It is the most common type of incontinence and can almost always be cured. Urge incontinence, the inability to hold urine long enough to reach a toilet. It is often found in people who have conditions such as diabetes, stroke, dementia, Parkinson's disease, and multiple sclerosis. It can also be a warning sign of early bladder cancer or, for men, an enlarged prostate. Overflow incontinence, the leakage of small amounts of urine from a bladder that is always full. In older men, this can occur when the flow of urine from the bladder is blocked. Another cause is loss of normal bladder contractions in some people with diabetes. Functional incontinence occurs in many older people who have normal urine control but who have difficulty reaching a toilet in time because of mobility problems. Level 3, page 18. Cardiovascular system. The cardiovascular system is the circulatory system and consists of the heart, blood vessels, and the blood. The cardiovascular system functions by pumping blood around the body, delivering oxygen and nutrients to cells. The blood is transported by arteries, which carry it away from the heart, and by veins, which return it to the heart. How aging affects the cardiovascular system. The aging process affects the cardiovascular system in a number of ways. Some of these effects are the heart is less able to pump efficiently, and less blood pumped results in lowered blood oxygen levels. The limits of the heart to exert itself are reduced with age. Blood vessels lose elasticity with age, resulting in the heart having to pump harder to circulate the blood. Medications are processed and eliminated differently in comparison with young adults. Heart failure. Heart failure, congestive heart failure, occurs when the heart muscle becomes weak. This can be caused by a heart attack or high blood pressure and can happen slowly but usually gets worse over time. Gradually, the heart loses its ability to pump enough blood to supply the body's needs. Chronic heart failure occurs when the heart is unable to pump enough blood for adequate circulation to the body's tissues. Heart failure is more common in people over the age of 65. Medication may include a combination of drugs. Lifestyle modifications include the minimal use of salt, which increases fluid buildup. Exercise is also helpful for maintaining general heart fitness and independence. Some people experiencing heart failure can benefit from surgery to improve blood flow through and from the heart. The symptoms of heart failure can seem like the normal signs of aging and include shortness of breath, even during mild activities such as walking a short distance. Difficulty breathing, especially when lying down. The person often requires extra pillows to avoid these breathing problems. Weight gain with swelling in the legs and ankles from fluid retention. General tiredness and feeling weak all the time.
A stroke is also called a cerebrovascular accident, or CVA. It is a sudden event in which a part of the brain has an interruption to its blood supply or a blood vessel inside the brain bursts. The brain cells around the affected area die as they stop receiving necessary oxygen and other nutrients. There are two forms of stroke: ischemic, blockage of a blood vessel supplying the brain, 85% of strokes, and hemorrhagic, bleeding into or around the brain, 15% of strokes. A mini-stroke or transient ischemic attack, or TIA, may be a warning for a stroke. About 25% of people who recover from their first stroke will have another one within 5 years. The symptoms of a stroke include the sudden onset of some or all of the following: numbness or weakness, especially on one side of the body; confusion; speech difficulties, speaking or understanding speech; trouble seeing in one or both eyes; difficulty walking with dizziness, loss of balance, or coordination; a severe headache. Risk factors for stroke include high blood cholesterol, high blood pressure, hypertension, heart disease, obesity, smoking, and diabetes. Men have a higher risk for stroke, but since men do not live as long as women, women are generally older when they have strokes and are more likely to die from them. The hormonal changes during pregnancy, childbirth, and menopause also increase women's risk for stroke. A stroke can affect the whole body, depending on the location of the obstruction to the blood supply and the extent of brain tissue affected. For example, there can be complete paralysis on one side of the body, called hemiplegia, or one-sided weakness, called hemiparesis. Problems with thinking, awareness, attention, learning, judgment, and memory. Difficulty controlling emotions or making expressions that are not appropriate for the situation. Numbness or strange sensations, especially in the hands and feet, made worse by movement and temperature changes, especially cold temperatures. Stroke recovery is ongoing, and special challenges for a person include coping with the frustrations and emotional changes, learning to accept and deal with communication difficulties, accepting the physical limitations, tiredness.
Level 3, page 20, nervous system. The nervous system comprises the brain, the spinal cord, and a network of nerves that go through all the organs and muscles and out to the skin. It is divided into two parts: the central nervous system, CNS, and the peripheral nervous system. The nervous system is responsible for a wide variety of functions, including relaying messages, triggering the muscles, carrying out automatic reflexes, responding to the senses, thinking, and memory, and giving us the capacity to analyze information and make judgments. There are two types of cells in the peripheral nervous system: sensory nervous cells and motor nervous cells. Chemical activation of the cells transmits messages through the nerves. Messages, to make muscles work, are decided by the brain and travel outwards from the brain through the motor nervous cells. Cells of the sensory nervous system send information to the CNS from internal organs or from external stimuli to the brain for analysis. Certain body activities controlled by the peripheral nervous system operate automatically and include the functioning of the digestive system, heart, and breathing. These are under the control of the autonomic system, meaning involuntary. The somatic system is controlled directly by the person. This is voluntary activity and includes seeing, hearing, smelling, tasting, and touching. Our senses of taste and smell deteriorate with age, as does our ability to see and hear. The reflex system is a third system that is mainly involuntary and is a reaction to danger. The danger generates a message and triggers an immediate reaction in the appropriate muscles. Reflexes vary from a simple arm or knee jerk to pulling your hand away from a hot object.
Level 3, page 21. How aging affects the nervous system. Alzheimer's disease. Alzheimer's disease is a form of dementia. Dementia is a progressive neurological disorder with increasing brain dysfunction. A reduction in the neurotransmitter acetylcholine causes changes within the brain cells, which disrupts the electrical charges and the cell's ability to connect or communicate with other cells. Cell destruction or changes causes a loss of brain function controlled by those cells. Alzheimer's is a degenerative disease that progresses over years. Memory, thinking, judgment, emotion, and behavior are affected. People's ability to perform tasks is affected, from complex tasks like driving a car to simple tasks like eating. There is no known cure. For people living with dementia, the changes in the brain make it more difficult for them to act in the ways they have normally done in the past. The effects of these changes can be made worse with changes in the environment, the person's health, or with the medication the person takes. Sometimes the loss of memory and resulting confusion can cause different emotional reactions and behavior patterns that take a special effort to manage. The resulting behavior of a person with dementia can become very challenging for the people who provide support. Repetitive behavior is one of those challenges. This means repeating words, asking, or doing the same things over and over again, even when a question has been answered just a few minutes before. Sometimes the person will follow you around or constantly be in your space. This can cause anger and frustration for the person providing support. People with dementia are often at their best early in the day. As the day progresses, however, the person's memory and ability to carry out tasks can deteriorate. Sundowning is the term used to describe the increased confusion, restlessness, and agitation that occur later in the day and evening, and sometimes into the night in the moderate to severe stages of dementia. Wandering is common among people with dementia. It can be a real cause for concern when their failing memory and difficulty in communicating make it hard for them to get the help they need to return home. Helping the person with dementia to remain safe is the most important part of managing wandering. Level 3, page 22. Parkinson's disease. Parkinson's disease is a progressive condition of the nervous system. It usually begins slowly with symptoms developing quite gradually. People often think slowness of movement relates to old age, and Parkinson's disease may not be diagnosed until other symptoms occur. The condition affects about 1 in 500 people, and the condition is more common from late middle age onwards. About 1% of people over age 60 have Parkinson's disease. Men develop Parkinson's disease slightly more often than women. The cause of Parkinson's disease is related to the degeneration of nerve cells in the center of the brain. These nerves produce dopamine, which acts as a chemical messenger to transmit messages from one nerve cell to another. The nerve cells fire out-of-control messages, causing difficulty with directing or controlling movements. When 80% of dopamine is lost, the person starts to experience symptoms of the condition. People experience tremors, stiffness, slow movement, called bradykinesia, and poor balance and coordination. As these symptoms worsen, people with Parkinson's disease can have difficulty walking, talking, or completing other simple tasks. Tremors can make people very tired. Not everyone with Parkinson's disease will have a tremor.
The shaking usually begins in one of the hands or arms, especially when that part of the body is at rest, and usually decreases with use. Shaking may become more noticeable when stressed or anxious. Starting movement, such as getting out of a chair, can become difficult, and everyday tasks can take longer to complete. Muscles are tense due to stiffness. This makes facial expression, fine finger movements, such as writing, turning over in bed, or turning around much more difficult. Falls are a risk due to poor balance and a slight foot drag, which makes tripping likely. There may be episodes of freezing, which leaves people stuck in place when starting a step. People with Parkinson's disease often have less facial expressions, making it difficult to show emotion and use body language effectively. They may have a quiet voice and speak without expression of the voice, slurring words, or talking in a rush. They may also experience other problems such as depression or emotional changes, difficulty swallowing and chewing with risk of choking episodes. The cause of Parkinson's disease is not fully understood, and currently there is no cure. In the early stage, there may be no need for treatment, but as the condition develops, medication is used to control symptoms and help maintain quality of life. The brain recharges its dopamine overnight. People with Parkinson's may have good mornings, but deteriorate over the day, so adequate sleep makes a difference. People with Parkinson's disease can benefit from regular exercise, which seems to improve the body's response to dopamine. At least 20 to 30 minutes of exercise each day, including stretching, helps relieve muscle spasms. Keeping things simple and doing tasks in the least tiring way helps conserve energy. This requires planning for the day, to avoid rushing and to maintain energy for heavier activities. Setting priorities about what is important. Keeping the body in a good position, for example, sitting, standing, resting. Pacing activity to avoid exhaustion by breaking down a task into smaller tasks, including breaks when necessary. Medication aims to restore the balance between dopamine and other chemical transmitters. Some medication must be taken regularly and at specific times if the person is to get the most benefit. You may need to assist the person to take their medication at the right times. There may be unwanted side effects such as mood swings, hallucinations, dry mouth, and constipation.
Level 3, page 24-25. Depression. Depression is the most common mental health problem amongst older adults and has a significant impact on individual patients, their families, and society. Depression is an illness that involves the body, mood, and thoughts. It is a mood disorder showing symptoms such as persistent feelings of hopelessness, low mood, poor concentration, lack of energy, inability to sleep, and sometimes suicidal tendencies. Depression affects the way a person eats and sleeps, the way they feel about themselves and the world around them. Without treatment, symptoms can last for weeks, months, or years. Appropriate treatment, however, can help most people. Most people experience periods of sadness or feeling down during their life. Most are able to return to normal activities within a short period of time. But when these feelings of sadness and other symptoms make it hard to get through the day, and when the symptoms last for more than a couple of weeks, it is called clinical depression. Major depression interferes with the ability to work, study, sleep, eat, and enjoy what were once pleasurable activities. Such a disabling episode of depression may occur only once, but more commonly occurs several times in a lifetime. About 12% of men and up to 25% of women suffer from depression during their lifetimes.
More women attempt suicide, but men are more likely to be successful. Depression is 3 to 5 times more common in the elderly than in young people, but it is not a normal part of aging. Common features of depression include loss of interest in activities that were once interesting or enjoyable, including sex, loss of appetite with weight gain or overeating with weight gain, loss of the ability to express emotion, a persistently sad, anxious, or empty mood, feeling hopeless, pessimistic, guilty, worthless, or helpless, avoiding social activities, unusual fatigue, low energy level, or a feeling of being slowed down, sleep disturbances including insomnia, early morning awakening, or oversleeping, trouble concentrating, remembering things, or making decisions, unusually restless or irritable, physical problems such as headaches, digestive problems, or chronic pain that do not respond to treatment and are persistent, thinking about death or suicide or making a suicide attempt. Alcohol or drug abuse may also be signs of depression. The cause of clinical depression is likely to be different for different people. Sometimes a depressive episode can occur suddenly when everything seems to be going fine. Other times, depression may be directly related to a significant event in life, such as losing a loved one, experiencing trauma, losing a job, or battling a chronic illness. There are risk factors which make people more likely to experience depression, such as a previous depressive experience, a poor system of support, a family history of depression. Depression in older adults is often related to changes that they face, such as bereavement, loss of independence, health problems, and chronic pain. Older adults are likely to complain more about the physical rather than the emotional signs and symptoms of depression, and so the mood disorder may not be recognized. Different types of depression require different types of treatment and are quite individual. There are effective self-help ways of dealing with mild to moderate depression, such as regular physical exercise, relaxation techniques, and being involved in social activities. Older people sometimes find that these self-help techniques are difficult to implement when they have other medical conditions to manage as well. More serious depression is most effectively treated by a combination of drugs and psychological therapies in which the person discusses their situation with a trained professional called a psychotherapist. There are a variety of antidepressant medications, and more than one may need to be tried to get the best effect. Most antidepressant drugs can take several weeks before an improvement is noticed. Early intervention and treatment usually reduce the time and intensity of depression.
Level 3, page 26, sensory system. Our human sensory systems include the ability to taste, smell, touch, hear, and see. Hearing. Your ears have 2 jobs: hearing and maintaining balance. Hearing occurs after vibrations cross the eardrum to the inner ear. They are changed into nerve impulses and carried to the brain by the auditory nerve. Balance is controlled in a portion of the inner ear. Fluid and small hairs in the semicircular canal stimulate the nerve that helps maintain balance. How aging affects hearing. As you age, your ear structures deteriorate. The eardrum often thickens and the inner ear bones and other structures are affected. It often becomes difficult to maintain balance. Some hearing loss is almost inevitable as we age, and it may decline, especially in the region of high-frequency sounds. This age-related hearing loss is called presbycusis. It is estimated that 30% of all people over 65 have hearing impairment, and about 5% of people over 60 will need a hearing aid.
The sharpness of hearing may decline slightly beginning about age 50, possibly caused by changes in the auditory nerve. The brain may also have a slightly decreased ability to process or translate sounds into meaningful information, and it may be difficult to hear in a crowded, noisy setting. Level 3, page 27, sensory system, vision. Vision occurs when light is processed by your eye and interpreted by your brain. Light passes through the transparent eye surface, cornea. Your pupil is an opening to the eye interior. It becomes larger or smaller to control the amount of light that enters your eye. The colored portion, or iris, is a muscle that controls the pupil size. The inside of your eye is filled with a gel-like fluid. There is a flexible, transparent lens that focuses light on your retina, the back of the eye. Your retina converts light energy into a nerve impulse that is carried to the brain and interpreted. How aging affects vision. All of the eye structures change with aging. The cornea becomes less sensitive, so injuries may be noticed. Your pupils decrease in size and focusing becomes less accurate. The pupil may also react more slowly in response to darkness or bright light. From the fourth decade of life, normal vision begins to decline, including changes to depth, light, color, and the ability to read small print. There may be difficulty adjusting or estimating distance and to refocus from close-up to distance. It may take a person a few seconds longer to recognize someone who was across the room when the older person has been reading or doing handwork. The lens of the eye yellows, making it more difficult to see red and green colors. Sensitivity to glare increases. Night vision is not as acute. These all affect driving safely. It is common for older people to have corrective lenses, either glasses or contact lenses. Telephone books, newspapers, and forms may be a challenge to read without glasses. Changes in depth perception can make it difficult to judge the height of curbs or steps, increasing the risk of falls or tripping. Depth perception has an effect on mobility, as the floor may appear to be rolling or moving, resulting in people shuffling along to counteract the perception and ensure stable footing. Level 3, page 28. Sensory system, taste and smell. Taste and smell. The sense of smell begins at nerve receptors high in the membranes of the nose. It is thought to decline with age, although poor health status or smoking may have greater impact than aging. The senses of taste and smell interact closely, helping you appreciate food. Most taste really comes from odors. Lack of smell can affect pleasure and satisfaction obtained from food. Changes in the ability to smell also have implications for safety, personal hygiene, and enjoyment of life. Loss of smell can put an older person at risk of the dangers associated with eating spoiled food or not responding to smoke or leaking gas. Some medical conditions, such as Alzheimer's disease or head trauma, can cause loss of smell or the inability to understand or distinguish smells. We all have approximately 9,000 taste buds. Taste buds are primarily responsible for sensing sweet, salty, sour, and bitter taste. It is natural for older people to lose some of their ability to taste. However, most can still identify sweet, sour, bitter, or salty foods, especially when these flavors are concentrated. The ability to taste has a huge effect on health because lack of taste may lead to older people making food choices that do not have sufficient nutrients for good health. How aging affects taste and smell. The number of taste buds decreases as we age, beginning at about age 40 to 50 in women and at 50 to 60 in men. each remaining taste bud also begins to atrophy or lose mass. The sensitivity to the four taste sensations does not seem to decrease until after age 60. If taste sensation is lost, usually salty and sweet are lost first, with bitter and sour tastes lasting slightly longer. Age changes the sense of taste because there is less saliva that is needed for taste. The number of taste buds decreases. There is less ability to determine sweet/sour tastes.
Level 3, page 29. Sensory system. Touch. The skin is the largest organ of the body and has millions of nerve endings. People thrive on stimulation through touch. The sense of touch may be the most important of the senses, yet is often the most neglected. The sense of touch also includes awareness of vibrations and pain. The skin, muscles, tendons, joints, and internal organs have receptors that detect touch, temperature, or pain. The brain interprets the type and the amount of touch sensation. It also interprets the sensation as pleasant, such as being comfortably warm, unpleasant, such as being very hot, or neutral, such as being aware that you are touching something. How aging affects touch. It is believed that with aging, you may have reduced or changed sensations of pain, vibration, cold, heat, pressure, and touch. It is hard to tell whether these changes are related to aging itself or to its disorders that occur more often in the elderly. Regardless of the cause, many people experience changes in touch-related sensations as they age. It may be harder, for example, to tell the difference between hot and cold. Decreased temperature sensitivity increases the risk of injuries such as frostbite, hypogomia, and burns. The loss of the sense of touch can be caused by a number of factors, including Parkinson's disease, mini strokes, TIA, lack of blood flow to the hands because of swelling, arthritis, not using limbs or muscles as the person may be bedridden or continually sitting.
Level 3, page 36. 6. Reproductive system. The reproductive system consists of the organs which work together for the purpose of sexual reproduction. Unlike the other body systems, the reproductive systems of men and women are different. The female reproductive system has two functions. The first is to produce egg cells, and the second is to protect and nourish the offspring until birth. The male reproductive system has one function, and it is to produce and deposit sperm. Many non-living substances such as fluids, hormones, and pheromones are also important accessories to the reproductive system. How aging affects the reproductive system. As we age, the reproductive system changes in both men and women, but sexual activity usually continues. Menopause usually starts in women from about 40 years onwards. The ovaries shrink in size and stop producing eggs, and the hormone balance changes. Tissues become thinner, drier, and less elastic. Reduced vaginal secretions may give discomfort during sexual intercourse. Menopause is usually completed by the mid-50s. Male menopause, the termination of the reproductive function, is generally from the mid-50s onwards. Testosterone production reduces, and genitalia may shrink. A common condition that occurs is an enlarged prostate gland, which can lead to difficulty in urinating and gaining an erection. The prostate gland sometimes needs removing.
Level 3, page 30, 31, 7. Endocrine system. The endocrine system produces a variety of hormones, body chemicals. These hormones trigger organs to function. Some of these hormones include adrenaline, makes the heart beat faster, circulating the blood and oxygen through the body more quickly in times of stress or exercise, when they are most needed. Testosterone is a male hormone produced by the testes. It controls male functions like development of body shape and the growth of facial and body hair, and voice depth. Estrogen controls femaleness, such as the development of breasts and shape of the hips. Reduced production of estrogen after menopause can lead to osteoporosis, which is a gradual weakening and loss of bone substance that results in decreased height and brittle bones. Progesterone stops the production of eggs, ovulation, during pregnancy. Ovaries produce both estrogen and progesterone. Insulin is produced in the pancreas and is vital in processing sugars. Too little or too much insulin can lead to diabetes. Other hormones are produced by different organs and glands. For example, the thyroid gland in the throat produces thyroxine, which controls growth and development by regulating the body's metabolism. Diabetes. This is a condition where there is too much or too little sugar or glucose in the blood. When food reaches the stomach, it is changed into sugar. The sugar enters the bloodstream and then the body cells, where it is used for energy. For the sugar to reach the cells, the cell membrane needs to be opened. This is called osmosis. Insulin is the hormone that opens the body cells and is also how the blood sugar level is kept within normal limits. When a person has diabetes, the pancreas is unable to make enough insulin to accommodate the amount of sugar in the bloodstream. If the problem is not managed, the sugar stays in the bloodstream and can accumulate in the body, causing damage to blood vessels, the retina in the eye, and the kidneys. There are two types of diabetes, type 1 and type 2. Type 1 diabetes occurs in a variety of people, including young people, but can happen to people of all ages. Type 1 diabetes is also known as insulin-dependent diabetes. This is when the pancreas makes little or no insulin. People suffering from this type of diabetes need insulin injections all their lives. Type 2 diabetes is more common and usually affects older, overweight people whose pancreas does not make enough insulin, so the insulin does not work properly. The symptoms include tiredness, thrush, which is the itchiness around the vagina or penis, and blurred vision. Diet and exercise are used to control the insulin levels. Type 2 diabetes. This is the most common type of diabetes and usually affects older, overweight people whose pancreas does not make enough insulin, so the insulin does not work properly. The symptoms include tiredness, thrush, which is the itchiness around the vagina or penis, and blurred vision. Diet and exercise are used to control the insulin levels.
Level 3, page 32. 8. Respiratory system. The respiratory system enables us to breathe air. Air is a mixture of gases, with oxygen being the most important for humans. The respiratory system consists of the lungs, airway, and diaphragm. How aging affects the respiratory system. As the respiratory system begins aging, the lungs begin to lose their elasticity. This causes the lungs to become less efficient in processing oxygen and decreases the amount of carbon dioxide that can be expelled. As a result, the respiratory system aging process affects all organs and tissues in the body. The less oxygen the body is receiving, the harder it is for the body's systems to function at peak capacity. How well the lungs supply the body with oxygen seems to relate directly to age. The amount of oxygen delivered to the bloodstream and the rate of blood flow declines with age. Even with the lung capacity remaining normal, the lung tissue seems to lose the facility for making the oxygen to blood transfer to the bloodstream. Since older people cannot breathe as fast, there is less oxygen entering the blood per minute. Less oxygen in the system cuts down the amount of work that can be done. Diseases that can occur more frequently as we age include pneumonia, chronic bronchitis, chronic obstructive pulmonary disease, asthma. All of these illnesses occur as the respiratory system aging process advances. These common illnesses can be fatal in a person with a compromised respiratory system. Maintaining the respiratory system involves a healthy lifestyle that includes a good diet, plenty of exercise, and enough rest.
Level 3, pages 33, 34, 35. Chronic obstructive pulmonary disease, COPD. This is a general term for people who have long-term breathing diseases such as asthma, emphysema, and chronic bronchitis. Chronic obstructive pulmonary disease, COPD, is an incurable condition in which the lungs are damaged, making it hard to breathe. The airways, tubes that carry air in and out of the lungs, become partly obstructed, making it difficult to breathe air in and out. COPD is a major cause of chronic illness and death. The airways branch out like an upside-down tree, and at the end of each branch are many small balloon-like air sacs called alveoli. In healthy people, each airway is clear and open. The air sacs are small, and the airways and air sacs are elastic and springy. When breathing in, each air sac fills up with air like a small balloon. When breathing out, the balloon deflates and the air goes out. In COPD, the airways and air sacs lose their shape and become floppy. Airways may also become inflamed and thickened. COPD affects the air sac's ability to transfer oxygen. Less air gets in and less air goes out because the airways and air sacs lose their elasticity, like an old rubber band. The walls between many of the air sacs are destroyed. The walls of the airways become thick and inflamed, swollen. Cells in the airways make more mucus, sputum, than usual. This tends to clog the airways and reduces airflow. Smoking is the most common cause of COPD. Breathing secondhand smoke can also be a factor in developing the condition, as can other kinds of lung irritants like pollution, dust, or chemicals, which over a long period of time may also cause COPD or make it worse. COPD develops slowly, and the damage is irreversible. The person may start to notice symptoms such as shortness of breath. COPD is often diagnosed in middle-aged or older people. COPD includes conditions such as emphysema or chronic bronchitis. Many people will have one or both of these conditions. The signs and symptoms of COPD include a cough that does not go away, although not everyone with COPD has a cough, mucus, sputum, production, shortness of breath, wheezing and chest tightness. Other terms for COPD are chronic obstructive airway disease, COAD, and chronic obstructive lung disease, COLD. Lung infections are a common complication because the damage that has occurred makes the lung tissue prone to infections. If the lungs are severely damaged, the heart may also be affected, reducing the amount of oxygen getting to the body's organs and tissues. As the symptoms of COPD get worse over time, a person may have more difficulty with walking and exercising and carrying out day-to-day activities. This can severely affect quality of life. Treatment for COPD is aimed at slowing the progress of the disease, preventing complications, prolonging life, and improving quality of life for the affected person. There are several treatments and medication. Bronchodilator medicines help the airways remain open. They are inhaled and go directly into the lungs where they are needed. There are many kinds of inhalers, and it is important to know how to use them correctly. You may need to support someone to use their inhaler and spacer. Steroids work to reduce airway inflammation. These are often inhaled through inhalers or nebulizers. Tablet forms are also used.
Antibiotics are used to treat infections at an early stage. Oxygen treatment is for people with low levels of oxygen in their blood. Using extra oxygen for more than 15 hours a day can be helpful, as it allows people to do tasks or activities with less shortness of breath, be more alert, limit damage to their heart, and sleep better. Although there is no cure for COPD, symptoms can be managed and damage to the lungs reduced. The person should keep away from smokers, pollution, dust, fumes, and strong smells. Have a flu vaccination every year. Avoid people who have upper respiratory infections, such as colds and coughs. Exercise regularly within their ability. Eat healthy foods, including plenty of fruit and vegetables, and protein food like meat, fish, eggs, and milk. Seek medical attention if symptoms are getting worse. Hospitalization may be necessary if the condition gets worse and the person has a lot of difficulty getting enough air or is experiencing breathlessness, has lips or fingernails that show a blue or gray tinge, has a rapid heartbeat.
Level 3, page 36, /9, integumentary system. The integumentary system consists of the skin, hair, nails, and exocrine glands. These glands produce sweat, oil, and wax to cool, protect, and moisturize the skin's surface. The skin is the largest organ of the body and grows faster than any other organ. It has 3 layers, from the surface of the skin inwards, called the epidermis, dermis, and subcutaneous layers. Hair, epidermis, dermis, subcutaneous tissues. The epidermis keeps producing new cells that push to the top of the skin's surface. Its thickness varies depending on the part of the body. For example, the eyelid is only 1 millimeter thick, while the soles of the foot and palms of the hand are much thicker. The pigment, melanin, which colors the skin, is in the epidermis. Every 24 hours, the surface of the skin sheds a layer of dead cells, constantly renewing every 28 days. The dermis is strong, elastic tissue. It contains blood vessels, lymph vessels, oil, sebaceous glands, and sweat glands. The hair follicles, which contain the roots of the hair, are also in the dermis. Hair and nails are special types of skin cells. Small involuntary muscles attached to the hair follicles cause the hair to stand up in response to certain emotions or temperature. The dermis provides nutrients to the epidermis. The subcutaneous layer is the deep underlying layer made of fat cells that act as a shock absorber between the skin and more delicate internal tissues and organs. The skin's biggest job is protection. It is a tough, elastic, flexible, and waterproof covering that helps protect other organs and body parts. The skin has 3 main functions. 1. Protective. Your skin's main job is to insulate and protect the body against bacteria and other foreign things. It resists moderate injury and can return to its previous shape and withstand considerable trauma without permanent damage. 2. Sensory. The skin can sense 5 different kinds of stimulation: touch, pressure, heat, cold, and pain. 3. Regulatory. The skin helps to control body temperature by distributing heat through the skin rather like a thermostat. It also provides a waterproof barrier and regulates the balance of fluids to prevent dehydration. It is able to absorb substances through the skin, for example, creams containing drugs. It also helps eliminate waste and salts from the body through sweat. Level 3, page 37 through 38, 9. Integumentary system. Skin. How aging affects the integumentary system. Skin changes are among the most visible signs of aging. These changes are related to environmental factors, genetic makeup, nutrition, and other factors.
The greatest single factor, though, is exposure to the sun. Effects of aging of the skin include wrinkles and sagging skin, which develop as skin loses strength and elasticity. Blue-eyed, fair-skinned people show more skin changes as they age. Whitening or graying of the hair is an obvious sign of aging. Gradual thinning, although the skin still has the same 3 layers, appears paler and becomes more sensitive to sun damage. Large pigmented spots, called age spots, liver spots, or lentigos, may appear in sun-exposed areas. The blood vessels of the dermis become more fragile, which can lead to bruising and bleeding under the skin. Rubbing or pulling on the skin can cause skin breakages, called skin tears. Bruises, flat collections of blood, called purpura, and raised collections of blood, called hematomas, may form after even a minor injury. Sebaceous oil glands produce less oil. For women, this becomes more noticeable after menopause. This results in dryness and itchiness. The subcutaneous fat layer thins, meaning the body is less able to maintain body temperature. With less natural insulation, older people often feel the cold. The sweat glands produce less sweat, making it harder to keep cool in hot weather. Growths such as skin tags, warts, and blemishes become more common. A reduction in the ability to sense touch, pressure, vibration, heat, and cold. Skin changes and loss of subcutaneous fat, combined with a tendency to be less active as well as some nutritional deficiencies and other illnesses, contribute to pressure ulcers. Slower healing of aging skin. Wound healing may be up to 4 times slower, leading to pressure ulcers and infections. Conditions such as diabetes, blood vessel changes, and lowered immunity also affect healing. More than 90% of all older people have some type of skin condition. Because most skin changes are related to sun exposure, prevention is a lifelong process. Excessive exposure to strong sunlight has also been directly linked to a variety of skin cancers. Other skin problems can be associated with diabetes, liver conditions, heart disease, and arteriosclerosis. Stress, reactions to medications, obesity, and nutritional deficiencies can be other causes. Chemicals, indoor heating, clothing, allergies to plants and other allergies, and many other common exposures can also cause skin changes. Prevent skin problems by maintaining good nutrition and drinking adequate fluids. Keeping skin moist with lotions. Avoid using soaps that are heavily perfumed. Moist skin is more comfortable and may heal better. Preventing sunburn by using sunscreen and covering up in the sun. Wear a hat, sunglasses, and sunscreen when outdoors in the sun, even on cloudy days.
Level 3, page 38. Ulcers. Terms used to describe skin damage by pressure are bedsore, decubitus ulcer, or pressure ulcer. An ulcer is a crater-like lesion on the skin or mucous membrane that may or may not heal. Ulcers can be internal, for example, gastric, or external, for example, venous or pressure ulcer. There is always some degree of tissue destruction involved. Leg ulcers may be acute or chronic, with skin loss occurring on the leg or foot. Acute usually follow a leg injury, trauma, or surgery and heal in a normal time frame, up to 4 weeks. Chronic may follow a minor trauma, skin cancers, or systematic disease.
They do not heal in the usual time frame and may break down and recur at the same or a nearby site. They affect 1% of middle-aged and elderly people. Ulcer is a crater-like lesion on the skin or mucous membrane that may or may not heal. Causes and treatment. Most leg ulcers develop due to poor circulation in the legs, either within the veins, causing a venous leg ulcer, or in the arteries, causing an arterial leg ulcer. People with diabetes are also at particular risk of leg ulcers. Leg ulcers may be caused or made worse by conditions such as poor circulation, often associated with blood vessel disease, venous insufficiency, a failure of the valves in the veins of the leg that causes congestion and slowing of blood which collects in the lower limbs, blood clotting problem, diabetes, renal or kidney failure, hypertension, treated or untreated, lymphedema, which is a buildup of fluid that causes swelling in the legs or feet, history of smoking, either current or past, pressure caused by lying in one position for too long, a malignancy or tumor or cancerous mass, infections, certain medications. The person may have a swollen leg and may feel burning or itching. There may also be a rash, redness, brown discoloration, or dry, scaly skin. Leg ulcers become more common with age. Although leg ulcers are often thought to only affect the elderly, about 20% of those who develop a leg ulcer are under the age of 40. Leg ulcers affect more women than men. Treatment is aimed at relieving pain and improving wound healing, along with treating or managing any underlying medical conditions. Treatments for leg ulcers may include topical wound treatment, dressings managed by the person themselves or overseen by specialist staff. There are a variety of special dressings used. Compression. Venous ulcers are treated with compression of the leg to minimize edema or swelling. Compression treatments include wearing compression stockings or bandages. Support workers must be fully trained if they are to assist with this treatment. Antibiotics. Present infections may require specific medications. Pressure points. Pressure points are points of pressure that may cause skin integrity breakdown. Skin integrity means that the skin is healthy, undamaged, and able to perform its basic functions. A skin integrity issue might mean that the skin is damaged, vulnerable to injury, or unable to heal quickly. A pressure wound, also called a pressure sore, bed sore, or pressure ulcer, is an injury to the skin and surrounding tissue. Pressure wounds usually form over bony parts of the body, such as the hips, sitting bones, shoulder blades, or base of the spine. Position changes are used to alleviate these pressure points. These position changes need to occur every 2 hours. Pressure points when standing, sitting, or lying.
Level 3, page 41, 42, and 43. Immune system. The immune system is a network of organs, glands, and tissues that protects the body from foreign substances. It is important for keeping our bodies healthy.
It protects us against viruses, bacteria, and parasites, as well as identifying and removing cancer cells and toxins. The major components of the immune system are organs such as the thymus, spleen, and lymph system, bone marrow and white blood cells, antibodies, hormones. How aging affects the immune system. Our immune system's ability to perform decreases with age. These changes happen at all levels, from chemical changes in how our cells communicate with one another to changes in immune organs altogether. As the immune system fails, elderly people are subject to infections, cancer, autoimmune disorders, or disorders directed against the body's own tissue, and many chronic diseases. Many diseases develop slowly and symptoms do not show up until later in life. Usually, the immune system is extremely effective in performing its work of defending the body. The immune system has defenses, the skin and mucous membranes, which are the first defense for preventing pathogens from entering the body. Pathogens can cause disease, for example, a bacteria or a virus. Other specific defenses come into action when any pathogens get past the first line of defense and invade the body. A major part of our immune system is the disease-fighting cells, called T cells or T lymphocytes. As we age, these cells lose the ability to function. The body retains the same number of T cells as before, but these cells are less able to control illness than the cells were in the earlier years. Another function of the immune system is to produce antibodies to ward off foreign invaders in the body, such as bacteria and viruses. These antibodies are produced in smaller quantities. This means that vaccinations, such as flu shots, may provide less protection than when a person was younger. For the immune system to work properly, the body must recognize that it has been invaded either by pathogens or toxins or by some other outside threat. The immune response must be rapid if it is to prevent the body being overrun by the invading pathogens. Once inside the body, a pathogen meets different defenses that the immune system has available. Diseases and problems with the immune system can be divided into two basic categories: those in which the body's ability to fight disease is impaired, those in which the immune system overreacts to stimuli, causing damage to other organs or systems of the body. The body can lose its ability to distinguish what is foreign and what is part of itself. When this occurs, it can lead to autoimmune disease. It also means that the immune system cannot identify and fight cancerous or malignant cells. This is one of the reasons that the risk of many cancers increases with age. Conditions that are associated with problems with the immune system in which the healthy normal cells are attacked for unknown reasons include rheumatoid arthritis, lupus, juvenile onset diabetes, multiple sclerosis, and psoriasis. Even allergies are believed to be related to dysfunction of the immune system, since the immune system overreacts to allergens. Level 3, page 44. The impact of aging on a person's daily life. In this section, we'll talk about aging in terms of a person's daily activities, lifestyle, and well-being. Now let's have a look at what these mean. Daily activities. Healthy aging is about maintaining health, function, and independence for physical, social, and emotional well-being. An older person may need support with their personal needs and activities of daily living. Eating. The digestive system is one of the least affected by age, but some changes do occur. Changes that can occur. 1. Mouth changes. in the mouth can affect eating patterns and appetite. The bone structure of the jaws may change, which can alter the way dentures fit. Saliva necessary to swallow food decreases, and teeth become more brittle. Examples of effects. Ill-fitting dentures make chewing difficult. Food choices become limited, leading to nutritional deficiencies. 2. Taste and smell. The sensitivity of taste buds and the sense of smell decreases with age, especially with men. The tastes that decline first are sweetness and saltiness, with bitter and sour decreasing more slowly. Examples of effects. Changes mean that foods may not taste like they used to, so extra seasonings are added. Changes in taste and smell may lead to a loss of appetite, which can result in nutritional deficiencies. 3. Stomach and intestines. Peristalsis, the movement of the intestines, is slower, decreasing speed and effectiveness of digestion and elimination. Examples of effects. Constipation. Person may not feel like eating or eats only small amounts, resulting in weight loss.
Level 3, page 45. Drinking. Changes that can occur. The amount of body water decreases by approximately 15% between 20 and 80, and the body becomes more susceptible to dehydration from a loss of a small amount of body water. The person may not recognize the need to drink more in hot weather or when there is an excessive loss of fluid through sweating, vomiting, or diarrhea. Examples of effects. Inadequate fluid intake can lead to constipation. This can occur as the bowel absorbs fluid back into the body, which makes the stools harder and drier. Dry mouth and bad breath can result from insufficient fluid intake. Mild dehydration occurs from inadequate intake of fluids. Mobility. Changes that can occur. Changes in gait with steps becoming wider based with smaller steps and poorer balance. Elderly people tend to walk with short, shuffling steps and with less of a tendency to swing their arms. Age-related changes include a decrease in bone density and vitamin D metabolism, which can cause a decrease in bone strength. Examples of effects. Falls associated with risk factors and slower reaction times. An increased risk of falls due to factors such as physical weakness, impaired vision, medication, changes in the center of balance and posture. The need for aids to assist with mobility, for example, walking sticks or frames. Fractures due to more brittle bones and reduced ability to react to a fall.
Level 3, page 45. Elimination patterns. Changes that can occur. A general weakening of the bladder muscles means that the impulse to urinate cannot be delayed as long as in earlier years. The bladder doesn't stretch to hold as much as it used to, so urination may be more frequent. The kidneys filter the blood more slowly than in younger years. Slowing of the digestive system. Examples of effects. With weakened muscles, the bladder may not empty completely, increasing the chance of urinary infections. Leakage of urine causing incontinence, especially when lifting, stretching, or coughing. Needing to get up at night to go to the toilet or going to the toilet more often and more urgently. Cannot hold on as easily as in the past. Medications remain in the bloodstream longer, meaning doses have to be carefully controlled to avoid over-medication. Constipation or occasional episodes of diarrhea. Level 3, page 46. Personal hygiene. Changes that can occur. a reduced range of movement due to stiffness, pain, arthritis, or other health conditions.
Examples of effects. Maintaining personal hygiene is made more difficult and compounded by mobility, dexterity, or elimination difficulties. This may be assisted by easy-access bathrooms, seating arrangements, and rails. Continence problems may require additional time and frequency of personal care activities. Toileting may be made more difficult through reduced mobility and environmental issues such as poor access. Assistance may be required to successfully complete the task.
Level 3, page 47. Dexterity, dressing and undressing, sleeping patterns. Changes that can occur. Dexterity is the ease and skill in physical movement, especially in using the hands and manipulating objects. Pain, arthritis, and a loss of strength in the muscles affects dexterity. Examples of effects. Loss of dexterity can lead to inability to perform simple daily tasks, such as opening jars or cans, inability to cope with buttons or other closing devices on clothing, and using knives and forks, a pen to write, or using a telephone.
Dressing and undressing. Changes that can occur. A reduced range of movement due to stiffness, pain, arthritis, or other health conditions, for example, stroke. Examples of effects. Dressing is slower and more difficult. Easy-to-put-on clothes are required to allow the older person to dress independently. Simple openings, easy access, loose and easy-fitting clothes are easiest. Continence problems may require modified clothing or specialized products to enable easy toileting.
Sleeping patterns. Changes that can occur. Older people generally need less sleep. Sleeping patterns can become disturbed, and lack of sleep creates additional physical stress on the body. Sleep needs change during the lifetime, but all ages need sleep for good mental and physical health. Good quality sleep allows the body to produce the human growth hormone that helps build muscle mass, thicken skin, and strengthen bones. Hormonal and immune system changes can also occur when the person does not get enough sleep.
Examples of effects. Older people often wake earlier and may take a short daytime nap to make up for any sleep deficit. Medication can mean a person needs to get up to go to the toilet at night, which disturbs sleep. Constant tiredness and irritability. More prone to developing conditions related to hormone imbalances or deficiencies, for example, diabetes.
Level 3, page 48. Lifestyle and well-being. Everyone experiences becoming older. The process of aging has other effects apart from the obvious physical changes to the body. While these changes are individual to the person, they can still have a huge impact on the way in which people are able to live their lives. Each person must adapt and adjust to the normal changes that are occurring as they age, and the success that a person has in making these necessary changes will have a major impact on the quality of life that they enjoy. Support may be needed for emotional and social aspects. This is known as psychosocial needs. Housing. The housing needs of people change throughout their lifespan as family size increases or decreases. For example, death of a spouse can lead to a rethink of housing needs. As people age, the type of housing they require can become very important if they are to remain independent for the longest possible time. Factors to consider are the size of the house for a person with reduced mobility, the levels, stairs, changes of level indoors and outdoors,
The location, including access to public transport, shops and services such as medical, social and recreational, schools and work. Affordability due to an increased or reduced income, changes in family size or makeup, mortgage or rent costs. The need for additional support and 24-hour care can mean a move to a residential facility or other type of supported accommodation. Work and income. Work can be defined as any activity that contributes to producing goods or services, whether or not the person is paid for this activity. As people age, they often change the nature of the work they do. People may change from full-time to part-time work, retire from paid employment, stop or start doing voluntary work, take time out from the workforce to study or care for family, whānau, or travel, work for short periods between travel or study, choose casual or part-time work for social contact and interest. Increasingly, older people are continuing to work past the accepted retirement age and value being able to make a meaningful contribution to their community, whether this is in paid or unpaid employment. When people are no longer in paid employment, they are likely to experience a change in their income level. People may have a variety of resources available to support them for this period of their life, for example, superannuation, investments, and pension schemes.
Level 3, page 49. Recreation. People of all ages use recreation as a way of refreshing their body and mind and relieving stress. As people age, their choice of recreation is likely to change because other factors such as mobility, transport, and health may mean that they cannot continue with their previous interests in the same way. Examples of changes that a person might make include changing from playing a full round of golf to playing a few holes and using a golf buggy. A person who played tennis every week may change to a less physical activity, such as yoga. A person who enjoys art may no longer be able to do the fine detailed work necessary for china painting. Instead, they may choose to do watercolor landscape painting instead. Relationships and family or whānau. Relationships are about the connections we have with people or groups and how we behave toward and feel about one another. We have relationships with a wide variety of individuals and groups, such as family, friends, work colleagues, service people, professionals, officials, etc. With age, some of these relationships remain the same. For example, we remain our child's parent throughout life. Other relationships will change. For example, we may no longer be an employee or an employer. Our family are the group of people who are most closely related to us by birth, marriage, or adoption. For others, it is the extended family unit or group of families in the same general area. As we age, we are more likely to rely on support from our family or whānau. Such reliance may relate to transport, shopping, decision-making, and support for medical appointments. For some elderly people, the absence of family available for support severely impacts on their ability to live independently.
Level 3, page 50. Cultural and spiritual. Culture is about who we identify with, be it of ethnic origin, or where we live, or what we believe. Culture influences how a person behaves. In some cultures, family, whānau, is expected to support their elders. This may include preparing and sharing meals, helping with their personal care, and helping them take medication. Spirituality is about our beliefs. It may be a church or a similar spiritual group, or other people who share the same beliefs and values. Companionship, sharing activities, and outings are important. Elderly people can easily become isolated and lonely, especially if they are living alone. Learning and memory. Brain experts believe that active learning helps maintain brain health by preventing loss of brain function in skills such as memory, reasoning, and judgment. Age alters the structure of the brain. It shrinks slightly in some people from about the age of 60 or 70. This affects how signals between different regions of the brain are relayed. The chemicals, called neurotransmitters, that relay messages within the brain become less available, resulting in a decline in memory among older people. The effects of brain changes are influenced by environmental factors, such as the amount of intellectual stimulation the person has, formal education, leisure activities, and professional interests can all help keep the mind stimulated and healthy. The brain works better when it acquires more knowledge because it helps build more connections throughout the brain. Memory is the ability to retain knowledge and experience and to be able to recall this knowledge when it is needed. Memory is both short-term and long-term. It is the long-term memory that is most affected by the changes that occur in the brain as we age. Long-term memory involves the information that needs effort to retain. This may be because it is meaningful, for example, information about family and friends, or because we need it, for example, job procedures, study material for an exam, or because we have had an emotional experience. For example, we cry when watching a sad movie, or when someone special dies, or we cry with joy when celebrating a great achievement. Another kind of long-term memory involves the skills and routines we perform so often that they do not require conscious recall or effort. For example, dressing ourselves or cooking a meal. In short-term memory, the mind stores information for a few seconds or a few minutes and is soon lost when it is no longer needed. The brain is designed to hold an average of 7 pieces of information.
Anxiety is a normal part of life. It is the feeling of worry, nervousness, or agitation, often about something that is going to happen. It can make us feel extremely apprehensive or fearful, even though the concern may be imagined rather than real. Older adults may worry about health, family, finances, and the end of their life. Elderly people may react with fear or panic when unexpected things arise, much like young people. Most people do experience periods of sadness or feeling down during their life. Depression occurs when these feelings do not go away. In older adults, it is often related to changes that they face, such as bereavement, loss of independence, health problems, and chronic pain. Older adults are likely to complain more about the physical rather than the emotional signs and symptoms of depression, so it may go unrecognized. Depression in the elderly is associated with poor health, a high mortality rate, and an increased risk of suicide, so diagnosis and treatment are extremely important.